Hello, everyone, and welcome to Science Together, a podcast series by DBT Wellcome Trust India Alliance, where we delve into the science driven by the researchers and the remarkable journeys in science. We're going to talk about tuberculosis today, a disease which still remains a pandemic, especially in densely populated areas of India and the world. I'm your host, Satish Chris Ravi. In this captivating episode, we are in the good company of Dr. Rashmi Rodrigues. Dr. Rodrigues is an intermediate clinical and public health research fellow with India Alliance. Rashmi, can you share the crux of your profile and research with us, please?
Yes, sure. Thank you so much, Satish, for this opportunity. I am Dr. Rashmi Rodrigues, an associate professor at the Department of Community Health, St. John's Medical College, Bangalore. I am also an India Alliance Fellow. My research currently involves infectious disease such as tuberculosis and HIV infections. More specifically, I have been involved in developing mobile phone adherence support solutions for treatment support in chronic diseases. Um, Currently, I work on treatment support for TB using mobile video technology, which is an alternative to something called directly observed treatment. If this strategy is successful, it could save a lot of resources for both the patient as well as the healthcare system. I have also worked with healthcare costs and qualitative research methods from the perspective of identifying healthcare solutions that are cost effective and acceptable to patients in an attempt to improve their quality of life.
And what motivated you to pursue this field of medical research?
Well, what motivated me specifically to pursue this field is that I have worked earlier with HIV infection and treatment adherence support using mobile technology. That was for my doctoral studies, and I had a background, therefore, with adherence support for long-term treatments. I thought that a follow-up of this with tuberculosis would be great because tuberculosis is also another chronic disease which has prolonged treatment, and patients do have issues with adhering to treatment, and they would, like HIV infection, also require support for making sure that they take all their medications with TB also. Um, yeah, so I think primarily this is what kind of motivated me uh, towards tuberculosis.
Dr. Rodrigues, can you break down for us what tuberculosis is and how it affects the body?
Yes, sure. So TB is an infectious disease. It's caused by a bacterium. It primarily affects the lungs, and it presents with cough, fever, weight loss over a prolonged period. It can also affect other parts of the body, so it's not just specific to the lungs in any way. If left untreated, the consequences of tuberculosis are not very good, and the chances of other people getting infected are greater. So, the issue with TB is that the treatment is for a long period, that is, for a period of 6 months. And it's absolutely important that patients take all their medications during this period of 6 months.
What demographic data can you share about persons who've come into contact with tuberculosis? Are there any noticeable trends that you'd like to share with us?
Well, in terms of demography, TB can affect just about anyone, irrespective of age, gender, wealth, or education. However, those who are undernourished, those who have low immunity, those undergoing stress, those who have diabetes are more likely to get infected with tuberculosis. Work environment as well as overcrowding are also known to play a role. One of the most important factors is the awareness of the disease itself, which plays an important role in both its prevention as well as its cure.
What were the main challenges that you've encountered in your research?
Well, the challenges that I have encountered largely was to set up the research group itself. Um, The next was development of the mobile application. It went through several iterations before we got it actually right. Now, combining medicine and technology was not at all easy initially, and we had a lot of discussions with the developers, and we realized that we hardly understood them and they hardly us. It took us some time to get onto the same page, and after that everything went smoothly. Then of course recently we've had COVID that came up, which kind of delayed our progress with the research overall. uh, and then, I mean, we were just trying to figure out how best we could continue amidst COVID. And then we realized that we had the very recipe that was needed to support patients uh, with their adherence in times of something like COVID, and that was using mobile technology, which is now quite rampantly used in healthcare, especially post COVID.
Do you have any recipes for success that you'd like to share with our listeners?
Well, I think it's very important um, to have faith, which is an important recipe for success, I would say, and that is faith in oneself. You also absolutely need to have uh, faith in your team, along with perseverance, and sometimes you have to be extremely persistent. It will, of course, get us a long way as a public health researcher, and it is also important for us to listen and to understand the feedback that we receive, not only from our fellow workers, but also from like our patients and others who kind of use our interventions uh, and the applications that we develop for the purpose of healthcare.
How has the coronavirus pandemic and lockdown affected TB infection rates?
Yeah, so the COVID has, to some extent, the COVID pandemic that is, has affected um, the TB detection rates largely. And I would say that once the lockdown commenced, there was approximately a 60% drop in the diagnosis of TB. This was primarily due to the restriction in movement. That is, many people could not get to a healthcare facility to be diagnosed. And therefore, they kind of stayed at home for a prolonged period. And it is likely that during this period, because they were not diagnosed and started on treatment immediately, that they did give the infection to others. However, the effects of the pandemic um, will we will be able to understand that not immediately, I must say, but in the long run, maybe about a year or 5 years down the line, we will know really what the pandemic has done for TB.
Have there been any cases of dual infections on COVID and TB? And if so, are there any noteworthy observations that you'd like to share?
Yes, we've had a few patients with TB and COVID, but we've not had any untoward consequences because of that. Um, and I think, yeah, I'm quite glad that most of our patients have made it through the pandemic.
How has your India Alliance Fellowship helped you and your research?
Well, I must say, I started out um, after my doctoral studies kind of quite fresh with starting a research group. But I was happy to receive funding from India Alliance. And a lot of times I say that I entered the fellowship alone, just by myself. And now I have a team of approximately 20 people that work with me and support my research. And in that way, I have been able to create a niche for myself in the field of tuberculosis. I have been able to develop networks, not only within our institution, but also with partner institutions and with the government. And we have our collaborations that are going on quite well. And our patients also have a fantastic rapport with us, for which I'm quite grateful to India Alliance overall.
Before we conclude, please share with us an element of your research project that you find most rewarding.
Yeah, so I think the element of research that I find most rewarding is the ability to actually generate evidence for policy and practice, and that is irrespective of whether the results are positive or negative. It's also important that researchers get recognized for the work that they do, irrespective of the results that they receive. And I believe this will go a long way in promoting research. And for me, this has been one of the most important aspects of research.
Thank you so much for taking the time to share your insights with us. Our conversation about tuberculosis brought many interesting issues to the fore, and I'm sure your work will inspire many to explore exciting careers in science and research. And thank you all for listening, everyone. More about the research that we've covered in today's episode is shared in the description below. And so concludes this episode of Science Together by DBT Wellcome Trust India Alliance.